And let's move to the next topic. I invite Caterina Zorou, Director of Web2Learn, and also Stefania Oikonomou, that is a scientist expert working at Web2Learn, and they are going to tell us about the role of citizens in innovating health. So you have 15 minutes.
Thank you very much. Before starting, I would like to thank on behalf of our Web2Learn team and our managing director, Katerina, who could not be today with us. But we would like to thank organizers of the workshop and the symposium, and particularly Jota Foka for the kind invitation. What to say? I followed with true interest the talks of previous CNAO experts, and I believe that our presentation now would further add on the discussion of citizens' role in innovating health. A few words about us. We are a Greek R&D company based in Thessaloniki. We are specializing in citizen science for social good. In practice, this means that we ideate, design, and implement projects in which citizen engagement plays a key role. Over these 10 years, we have building expertise in other 3 highly interconnected areas: open science, social innovation, and professional training, collaborating with universities, knowledge and research institutes at national, European, and international level, having reached more than 3,000 users and learners throughout these 10 years. Now, we have heard the term citizen engagement. Let's see in practice what that means. In broad terms, we mean that ordinary people of any socio-educational, socio-cultural background come together to contribute to scientific research processes. Usually their contribution is meant to be data collection, but that depends heavily on the objectives of your project and how much you want to engage your people in your research. We refer to citizens, not only patients, because as Sylvia also mentioned, in this framework, we have also a huge ecosystem of people and communities involved around the patients, who are, of course, the primary target group. We refer to the families of the patients, to the friends, to the healthcare experts, doctors, everyone involved in supporting the patient. Now, someone would ask why citizen engagement in health in this delicate environment? Well, there are multiple benefits for both science and society. Just to mention that for science, the pool of insights, not only data, but perspective and approaches related to the scientific research itself brings multiple benefits to the scientific teams. But also in society, we see more people engaged in science, and that means more trust in science and more participation and democratization of science. You may have heard so far similar terms related to public engagement in health research, for example, patient science, personal science, or participatory health research. All these plethora of terms refer to the way of public participation in health, and they all connected with 3 key objectives. They all somehow refer and emphasize the importance of engaging citizens in the process. All of those terminologies and concepts bring to the fore the need to democratize science. This means opening up scientific research, not only its results, but also the process, the way we engage and how we engage in each step of the scientific process, people. And of course, advancement of research breakthroughs. It's been proved that in many cases, in many participatory research projects, the contribution of citizens, the role of citizens have brought multiple benefits and breakthroughs in advancing science. Now, in health, we refer to personal health data, and of course, we mean to patients' data that are already collected by healthcare systems. These are sensitive data, and I will get back later on about the main concerns related to personal health data, how it should be collected, and how we should tackle their collection and availability to the public. Just to emphasize here that there is an interest at EU level about engaging citizens in health research. Last year, there was the first International Citizen Science Conference on Health organized by the European Citizen Science Association. Web2Learn was awarded a grant by the European Citizen Science Association to attend the conference, which, in our perspective, laid the foundation for more interest and synergies to expand what we call citizen engagement in health research. Also, EXA has its own working group on health, of which we are active members, and of course, as well as with other groups related to equity, inclusivity, and empowerment of citizens. Okay. Now, our perspective in this field is that we should move beyond citizens' contribution seen as pure data collection or insights provision. In our perspective, citizens should be empowered, should be provided the knowledge and tools to also shape the research process and become advocates of it. Just a few examples from what's already going on in terms of engagement of citizens in health research. This is famous Patients Like Me online platform that gathers users from all around the world in sharing their experiences, in their trajectories and their ways in healing from their health issues. So this is a leading participatory health platform where patients, doctors, and researchers are coming together, sharing experiences, understanding the way patients are experiencing this trajectory. And what's interesting here is that all this approach and all these efforts also result in increased knowledge, scientific knowledge, that is reflected in a number of studies in peer-reviewed medical and scientific journals. So we see how patients' contribution becomes also new knowledge for scientists and the scientific community. This time in Canada, we have the Citizen Science Platform set up by the Ministry of Health of Canada in collaboration with research institutions here. The researchers wanted to understand what are the post-COVID-19 symptoms of patients, and this way they set up this online platform where users who were affected by COVID-19 share their post-COVID-19 symptoms trajectory. All this data are collected by researchers and, of course, increasing their understanding of how better to help serve the needs of patients with post-COVID-19 symptoms. Some concluding remarks. What we would like you to keep from this presentation is that applying a citizen engagement approach in your health research project means that you not only believe in science for the people, but also science by the people. And that practically means that you build, and it's challenging, I see, but you practically want to build an empowering pathway for both your scientific team, but also for the citizens you want to engage in your project. Again, talking about why we should do that, what's the added value of all this difficult and challenging process, because of course, I will say, in the last slide, I will show some of the open questions, which are very difficult to tackle, but important to reflect upon. The added value of adopting this process is that you have more input in your research from people. You increase health literacy, as Sylvia put it also. You increase the understanding of communities and citizens themselves in how science operates, how research is going on. So you build more trust. And we have seen that in COVID times where people were very much distrustful about vaccines creation. So you see how people who were engaged in citizen science or participatory projects about vaccines, for example, build more trust in science and what you want to do and what's this impact in our lives. Of course, advocacy is another key concept that should be highly above in our focus on citizen engagement. So people who are engaged in this project are the best advocates of the research results, of the research process itself. And of course, interdisciplinarity, usually in participatory health research projects, we have a multiple and a variety of social actors collaborating with each other, from psychologists to citizen science experts to scientists itself. So there's more gains in terms of building multiple perspectives, coming together, creating a more relevant to society result. Now, as I said, that's very good to say that we want citizen engagement and that's our focus and our value, but there are some key hot open questions we should at least reflect upon, and there is usually and surely not a single answer to those questions, but we should take them into consideration where we want to build a participatory health project. First open issue is the data related to data repercussions. So there is the issue of data ethics, what this contribution of patients in your research means about the privacy of their data, which are the ethical considerations and dimensions of including citizens in your research. Another open issue is the contrast between personal and collective data. This means that would you like to focus on a single individual stories and pathways, or your project necessitates a massification of pool of data and inputs, and all these decisions and choices come with their limits and limitations in terms of research and results. And of course, there's always the question of GDPR compliance and what is the actual implementation and impact of open science for palliative care. We talk too much about open science, open data, but what about the issues of ownership? Who would be acknowledged and who would be owned the results of your data and of your research? What about disclosure, to whom your data will be available, and empowerment? We talk about very much about citizen empowerment. How do we in practice apply that, and how we ensure that at the end of the project we at least have enhanced at a certain level citizen empowerment? That's some of the open questions I would like to bring for you to reflect upon in this short talk. Thank you again for your attention.
Questions? Comment? If I may.
Exactly, for the for the impact and the evaluation of this. Okay. May I bring an example of our experience here? We have currently a citizen science project with deaf people. Yeah, let's take that. Okay. So we have a citizen science project with deaf people, and we've been called by the project organizers to evaluate in terms of impacts. And they said you can share questionnaires, for example. And our reply was that this is a particular target group in terms of difficulties they have in comprehending texts related to text-based impact assessment tools, but also because it's due to the health-related issues, which don't want, and the traditional survey-based impact assessment doesn't work. What we do instead is that we adopt art-based impact evaluation methodology. So by asking participants of this project to express how they feel, how they perceive, how they experience the process through art, we are able to facilitate assessment of these experiences. It could be self-portraits, it could be relational maps they build by drawing. We give them some focus keywords, but we try to be as less present in the process in terms of not giving them and not make them feel they have to answer specific in a specific direction, because
bias.
Exactly, because surveys a priori, let's say they try to define how the participants should reply. Of course, not yes or no questions are not enough in our context, in our environments to understand deeper. But we have seen, for example, that art-based methodological tools for impact assessment are a great source also of inspiration and self-expression.
Thank you.
Thank you.
So let's thank the speaker again. And now we move to the next talk.
Just one more minute, please.
Yeah, here closes the session in this room, but I just wanted to remind you that in the main auditorium, Professor Roberto Orecchia and Arnold Campos are giving a presentation in the framework of the Aristotle Medical Forum in the session of the role of artificial intelligence in radiation therapy. So I encourage you to just step in the main auditorium. Thank you very much.